And thanks for staying with us. Veterinarian David Graff joins us now to take your questions. 365-9999 is the number to call. And before we get to the phone lines, you have a very active kitty on your lap today.
I do. He's purring very loudly. His name is Cuff, and he's a 9-week-old male kitten. He's at the Cedar Rapids Animal Care and Control, and he's available for adoption. And all his litter mates have been adopted out, and he's the last one of his litter.
So he's the last one. So he needs a home.
He needs a home.
I believe we have Mike on the line with our first call today. Go ahead, Mike.
Yeah, hi, Doc. I recently gave my dog some, I think it's called Sense-Dry Pro flea and tick repellent, and he's showing some signs of irritation. He's biting at himself and licking himself a lot, to the point where he's almost taking some of his hair off.
Okay, he probably is still suffering from flea allergy dermatitis. It takes multiple treatments to get rid of the fleas. The very best flea and tick preparations are the topical ones, like Frontline, for instance, but it takes several days to kill the fleas, and you have to do multiple treatments several weeks apart to get rid of all the fleas. So if he's suffering from itchy skin, he may need some other medicine to help with that in the meantime, until the fleas are gone. So ask your veterinarian about something to help his discomfort while you're treating the fleas.
Sure, in the meantime. Okay, Karen's on the line with our next phone call. Go ahead, Karen.
Yeah, hi. I have a toy poodle and a Maltese, and they both tear really, really bad under their eyes.
Right.
And I was wondering if there was anything safely that I could do about that.
There's a lot of things they sell. You can go on the internet and find many preparations. There's one called Angel Eyes, for instance, but they sell so many of them because probably none of them really work very well. The reason that there is brown in the tears is a breakdown product from red blood cell metabolism. A porphyrin molecule that contains iron is in the tears, and so that's actually rust. And it's difficult to treat. It's very common in especially little white dogs like Maltese. So it's a frustrating thing. Usually doesn't cause any problem, but isn't very attractive.
Yeah, you just notice it more over time.
Especially in white dogs.
Yeah, and so it's not meaning that anything's getting worse. It's just a time issue thing. One thing you wanted to talk about, too, are instances of cats throwing up, which doesn't sound like a very pleasant thing. Yeah,
especially at lunchtime. My little kitty took off, and he's over there. He's adventuresome. If your cat is having vomiting, if he or she is acting normal, not acting sick, and is vomiting, it may be something as simple as hair. Cats groom themselves obsessively, especially long-haired cats. My little kitten today, who's not on my lap, is a long-haired cat.
Sure.
And long-haired cats have more hair, and the more hair you have, the more hair problems you have with vomiting. Cats don't always vomit up the hair. They can have hair that's causing that, and the only thing that comes up is their food. That's important to know. So, doctor, my cat vomits the food. It might be hair. However, here we go.
Here you go, assistant.
Here's my assistant. However, and he's purring really loud. However, your vomiting that continues may be a sign of something wrong, okay? Cats like to eat things. They like to eat twisty tabs. They like to eat the top of the milk carton. Your kitty may have consumed a foreign object. So just because we're vomiting and act normal doesn't mean it's just hair. Your veterinarian may have to do x-rays to determine. Or do blood tests, because there are many, many things that can cause vomiting. And if your kitty's acting sick and vomiting, it could be a sign of kidney disease, liver disease, diabetes, or intestinal disease. So these are just some things to think about. Not every vomiting cat has hairballs. However, most vomiting cats that act normal otherwise are afflicted with hair.
Great to know.
And there's hairball preparations you can give, and bathing and combing.
Sure. Dr. Graff, thank you so much. And stay with us while we're checking your forecast when we come back.